Study Session 9, Health and Illness. Introduction. In this session, you will learn about the concepts of health and illness. Their nature will also be discussed. Though health and illness are universal phenomenon, both concepts are variables, relative, and do not have universal definitions. What is health for one person at one time may be an illness for another, or even for the same person at another time. What then are the various submissions of the concept of health and illness? What is also their nature? Learning outcomes. When you have studied this session, you should be able to define health and list out its dimensions. Define illness. State the categories of physical illness and highlight causes of mental illness. Health and its dimensions. What is health? According to Payne and Hahn 2000, health refers to the virtual absence of disease, that is, low levels of mortality, and the ability to live a long life, or reduced risk of mortality. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. WHO 1947. This is a multifaceted view of health that encompasses physical, mental, and social dimensions. This definition indicates that health extends beyond the structure and function of our bodies to include feelings, values, and reasoning. It also embraces the nature of our interpersonal relationships and interactions. A currently popular conception of health expands on the WHO definition to embrace two additional components, namely intellectual and spiritual dimensions. Lederman, 1997. The holistically healthy person functions as a total person. Dimensions of health. Health has been viewed for many decades as being multidimensional. Hence, the dimensions of health could be physical, emotional, social, intellectual, occupational, spiritual, and environmental. We shall examine them one after the other. 1. Physical dimension. This has to do with the physical health of a person. It refers to the conditions or state of health of an individual or the physical characteristics of the individual, such as our body weight, visual ability, strength, coordination, level of endurance, level of susceptibility to diseases, the power of recuperation or recovery. 2. Emotional dimension. This encompasses our ability to cope with stress, remain flexible and calm. 3. Social dimension. This encompasses social skills and insights. It has to do with our ability to interact comfortably and meaningfully with other people in the society. 4. Intellectual dimension. This refers to the ability to process and act on information, clarify values and beliefs, and exercise decision-making capacity. This ranks among the most important aspects of total health. 5. Spiritual dimension. Originally, the spiritual dimension of health includes religious beliefs and religious practices. However, many young adults would expand it to include more diverse belief systems, including relationships with other living things, the nature of human behavior, and the need and willingness to serve others. 6. Environmental dimension. This has to do with the conditions in the air, water, land, and climate, and how they affect our health, growth, and development. Example, how air pollution, erosion, etc. negatively affect health, growth, and development. 7. Occupational dimension. This has to do with the importance of workplace to the physical and mental well-being of workers. It deals with the level of security, safety, and job satisfaction, and how all these contribute to the welfare and health of workers. Illness. Since there is health, there is bound to be illness. Life is not static. The Webster's International Dictionary defines illness as a state of being ill or sick, bodily indisposition or diseases. According to the Longman Dictionary of Contemporary English, 1995, illness is a disease of the body or mind. Illness encompasses medical, social, economic, psychological, and even spiritual components. It affects people in many ways, directly or indirectly, and it is of particular consequence to individuals, families, and communities. Skidmore et al., 1997. Broadly speaking, illness impairs role function and may result from factors like biological, e.g., infections, social, psychological, cultural, and economic factors. It forces dependency and reduces usefulness to the family and other significant people. It cuts off the individual access to normal enjoyment and satisfaction. It also renders the individual incapable of normal role performance. Types of illness. Illness can be mainly classified into two, namely physical illness and mental illness. 1. Physical illness. This implies a state of being unwell, characterized by bodily dysfunction. Mojonyola, 2002. It refers to the conditions affecting systems or organs of the body, such as respiratory, circulatory, excretory, reproductive, digestive, skeletal, endocrine, and muscular systems. Physical illness can be categorized as follows. A. Medical illness. This includes illnesses such as malaria fever, headache, pneumonia, hypertension, diabetes, and so forth. B. Surgical illness. This includes illnesses that require surgical operation. Examples of these are hernia, fractures, gunshot wounds, intestinal obstruction, appendicitis, etc. C. Psychosomatic illness. This refers to illnesses such as peptic ulcer, migraine, hay fever, duodenal ulcer, and so forth. Physical illness may be caused by infections of the body by pathogenic or microorganisms, such as bacteria, fungi, or virus, and injury or trauma to the body organs. Generally, physical illness may be characterized by fever, pain, diarrhea, nausea or vomiting, dizziness, etc. Physical illnesses are usually treated by drugs, surgical operations, and radiotherapy. Psychosocial treatments also play significant roles in the management of physical illnesses. 2. Mental illness. This is a type of mental disorder affecting the brain or mental processes. It is a type of illness or disease in which there is a disturbance in the brain, especially in the cerebral cortex. Portnov et al., 1965. This kind of illness also affects the whole body as it is manifested by metabolic, visceral, and endocrine disorder. Mental illness is characterized by disturbance in mood and personality, hallucination, that is, false perception, delusion, that is, false beliefs, distortions, loss of contact, etc. Causes of mental illness. According to Mbanefo, 1991, several factors cause mental illness. Some of the causes are examined below. 1. Natural causes. These are hereditary factors or genetic factors causing acute psychosis, mania, agitated delirium, and schizophrenia. 2. Malignant magical practices. Malignant magical practices of witchcraft, sorcerers, curses, evil spells, food poisoning can cause schizophrenia. 3. Supernatural causes. Mental illnesses such as psychosis and psychiatric disturbance are caused by ancestral spirits, gods and goddesses. Example, goddess of smallpox. 4. Body constitution. The physical and mental makeup of an individual can predispose him or her to mental illness. For instance, an individual who has reduced or no coping ability to handle frustration can easily break down with severe stress. 5. Damage to central neurons system, that is the brain. Damage or injury to the brain. Example, severe fall from a height or road traffic accident. Diseases affecting the brain, such as meningitis, encephalitis, new growth or tumor in the brain, or hardening of the blood vessels supplying the brain. Arteriosclerosis can lead to mental illness. 6. Unknown cause. Sometimes the cause of some mental illnesses may not be known. Types of mental illness. Two major types of mental illness are neurosis and psychosis. 1. Neurosis. These are minor mental disorders in which the victim has developed certain behavioral patterns that avoid rather than cope with problems. Thus, when an individual experiences conflict or frustration which is not quickly resolved, he or she either remains in the state of severe anxiety or uses one of the defense mechanisms to avoid the problem. Anxiety is the chief symptom of all neurotic conditions. This anxiety does not prevent the individual from performing his daily activities. Hence, he does not need to be hospitalized. Neurotic reactions may be anxiety, conversion, obsessive-compulsive and phobic reactions. Neurotic reactions can be characterized by anxiety, guilty feeling, excessive fear, restlessness, agitation, and so forth. 2. Psychosis. These are major mental disorders which involve more serious disturbances of thought and behavior than neurotic conditions. The personality of a psychotic individual is disorganized and his normal social functioning greatly impaired. Hilgard et al., 1979. Psychoses are quite different from neuroses as they involve physiological changes in the brain. Psychoses are characterized by distortion of perception and thought, loss of contact with reality, withdrawal into fantasies, hallucinations, delusions, and so forth. For these and other reasons, psychotic individuals need to be hospitalized for proper care and treatment. Psychoses may be organic or functional in nature. A. Organic psychosis. This refers to a mental illness which results from damage to the brain, diseases or infection of the brain, new growth or tumor in the brain, lead poisoning, and so forth. B. Functional psychosis. These are disorders that are presumed to be primarily psychological in origin or have genetic contributions and environmental conditions. Functional psychosis can be grouped into two, namely 1. Affective disorders. These are disorders in which there is disturbance in mood and no evidence of a specific lesion in the brain. In affective disorder, the individual may become elated, that is, manic, or severely depressed. He or she may alternate between periods of depression and elation, that is, bipolar disorder, or manic, that is, depressive psychosis. 2. Schizophrenia. This refers to the label given to psychotic disorder characterized by distortion of reality, withdrawal from social interaction, disorganization of thoughts, emotion, motor behavior, hallucination, delusion, and so on. Schizophrenia usually appears in young adulthood, and the peak of incidence is between ages of 25 and 35. Hilgard et al., 1979. Sometimes it develops slowly or may be of sudden onset, marked by intense confusion. Schizophrenia may be simple, hebephrenic, catatonic, and paranoid schizophrenia. Study session summary. In this study session, you learned that health is all-encompassing in the physical, social, spiritual, intellectual, and mental well-being. There are 7 dimensions of health. You also learned that illness is such that it renders the individual incapable of normal role performance. You learned the types of illnesses. You learned that there are physical and mental illnesses. Physical illness can be categorized into 3: medical, surgical, and psychosomatic. Mental illness could be neurosis or psychosis. Mental illness is caused by several factors. End of study session 9. Thanks for listening.